with MA3 Healthcare Solutions. And today I'm going to bring a little information on to try to bring clarity to your Medicare 101. In short, Medicare is only made of three parts: Parts A, Part B, and Part D. Okay, Part A, if you paid FICA taxes, you work 10 years or 40 quarters, broken up regardless of how many jobs you have. As long as it added up to 40 quarters, you get Part A free. Okay. Part B has a premium. It has a premium of $144.60 a month. Part D is Medicare prescription drug plan, and it is provided only by private insurance companies, and you have to pay premiums and co-pays associated with it, and get your medications. So let's break these things into individual pieces and go over them. Okay, for Part A pays for your room and board as stated in the hospital. It takes care of your inpatient hospital care, inpatient mental health, skilled nursing, hospice care, and some blood transfusions. Medicare does not pay for your first 3 pints of blood. You wonder why? I do not have the answer for that, but make sure that if something were to happen to you, you have somebody standing by, or you put it up in the bank for them, okay? So there are costs associated with Part A also. It's $1,408 is the deductible. And deductible is applied through what's called a benefit period. The benefit period is approximately 60 days. It is 60 days. Okay. And what if you had to stay in the hospital for longer than that? Okay, that $1,408 does not end there. If you were to stay in, say, 61 through 90 days, you have a $352 co-insurance payment that you'd have to pay. Say 91 days, now it's getting a little bit expensive. You'd have to pay $704 for each day beyond the 91st day. And you say, well, what will happen then if you didn't get your 40 quarters in? Well, some people don't, but you can still get Part A. Part A, like I stated previously, if you work for 40 quarters, it's free. But if you did not, 30 to 39 quarters, you're going to have to pay a monthly premium of $252. And what if you less than 30 quarters? You're going to have to pay $458 just for Part A. Now let's go on to Part B. Part B takes care of your doctors, your nurses, and all those folks running around the hospitals providing your services for you. And it provides for the physician services, outpatient hospital services, your ambulance services, outpatient mental health, lab services, durable medical equipment, outpatient physical therapy, and some preventive care. It's quite a few preventive care services provided there, but it is not free. You do have co-pays and co-insurance associated, and as I stated before, it is a premium associated with it of $144.60. And for the year 2020, there's a deductible of $198. After you've met your deductible, whatever costs for the doctors, nurses, and those other folks that's providing services for you, you are subject to 20% costs for those particular things. And you say, well, I don't really need it right now. I don't have to sign up for Part B because I'm not sick. If you do not sign up for Part B, you are subject to a penalty. Failing to enroll in Part B can cost you, buddy. It can cost you 10% more for your Part B premium each year. That'll be 10% of that $144, and it's cumulative. 10 years, you racked up another $144 that you'd have to pay on top of the initial $144. So it can be quite expensive. So let's go on from here, and we'll start talking about your Part D plan. Each individual company has a particular plan that they provide. Now, they do provide some catastrophic coverage that protects you from very high drug costs, depending on what that medication is. But the benefits can change each year. And as far as coverage is concerned, each particular plan per insurance company can have a separate list of medications. So you have to check the formularies when you're signing up for Medicare Part D, because all medications are not in that particular plan necessarily. So, and the enrollment is not automatic when you turn 65. You literally have to go and sign up for it. And what if you say, well, I'm not taking any medications? Well, it does not matter. There's a penalty associated with it. 1% of the national average cost of a Medicare Part D plan will be accrued monthly if you do not sign up when you are eligible for it. You do get a 60-day initial enrollment period, I guess you can call it a buffer, to sign up, but after that it starts accruing. Okay, and each individual drug plan does have what's called a formulary, which is tiered. That tier formula goes from tier 1 through tier 5. Tier 5 is the most expensive medication. Tier 1 is the least expensive medications associated with it. And you say, well, I really don't need that. Well, there's no choice, as far as our government is concerned. And with that, you have 4 different stages of your Part D coverage. First stage is your deductible stage. For year 2020, it is $435. After you've satisfied that deductible, you go into what's called an initial coverage stage. Your initial coverage stage is what you pay out of pocket and what the cost of the drugs to the pharmaceutical company is. Once it totals up to a total of $4,020, then you come out of that particular stage, coverage stage. It's called an initial coverage stage, and you go into what's called a coverage gap. I know we've all heard of the donut hole. And once you go into the donut hole, we're looking at 25% coverage, cost rather, for the medication, irregardless of whether it's a generic drug or it's a preferred drug. You stay into that stage until you get what you pay and what the pharmaceutical actual cost is. When it reaches $6,350, then you go into what's called a catastrophic stage. Once you go into that catastrophic stage, you'll either pay $3.60 for your generics, or $8.95 for your brand name, or 5% of whatever that costs for that medication. So it can get to be quite expensive. But there is some hope out there for individuals who are low-income individuals. They have what's called low-income subsidy. It's a plan that the federal government has that if you make under a certain amount, that you can actually literally get help paying for your medications. Okay, so it's just a matter of spending 10-15 minutes with one of our agents, and what they can do is they can go over this with you and literally sign you up for it and help you out and try to save you some, subsidy, provide a subsidy for maybe your premiums, your deductibles, co-payments, and maybe we could get rid of a late enrollment penalty that you might have incurred. Okay? Thank you. We'll get back to you in a little bit later.